Good day, sir. In this video, I'm going to perform my return demonstration for intravenous therapy and blood transfusion as part of our related learning experience. Before we start, we must do the following for patient safety. Wash your hands or perform hand hygiene. Provide patient privacy. Introduce yourself to the patient and verify patient identity using two identifiers. Good morning, I'm Nurse Marian. Can you please tell me your name and date of birth, please?
My name is Retdem, November 17, 1999.
Verify the allergy status and check the physician's prescription of the IV therapy. Take note that we will only do the procedure only upon the physician's prescription or order due to certain risks. Provide patient education by explaining the procedure, the rationale, and securing the informed consent. So sir, I'm going to perform an IV therapy on you today. This will not take too long because I will only administer fluids or medications directly into your vein. So the rationale for this is to provide for hydration purposes as well as to give nutrition for patients like you who cannot consume food or water by mouth. So do I have your permission po to proceed? Is that okay?
Yeah, sure.
The following are the needed equipments for the procedure. Sterile gloves. Sterile 2x2 gauze pad. Administration set. IV cannula. Sterile forceps. Cotton balls with alcohol or povidone iodine swab. Plaster or adhesive. Tourniquet. Protective pad. IV pole and IV solution. Since we have already verified the prescription for the procedure, introduce ourselves, identify the client, explain the procedure, and gave their consent, we must make sure to assess the patient's vein for appropriate site, size, location, and condition. Check the solution label and label the IV bottle with the patient's name, room or bed number, solution, time and date started, time and date to consume. Now we have to open the IV set. Make sure to check the date manufacture and that the date today does not go past the expiry date. Now that we have the IV set, we are going to spike the infusate container. And then we are going to close the roller clamp. And we are going to fill this chamber at least halfway and prime with IV fluid. Then expel the air bubbles, if you have any, to prevent the risk of air embolism. Then finally, cover the distal end of the IV set. In positioning the client, I will use my non-dominant hand to raise the bed on a good working environment for the client's comfort, as well as to adjust the lighting. We place the client's arm in a comfortable position, and then we place the protective pad on the bed just right under the patient's arm. To prepare the IV site, I will warm the veins by gently rubbing the veins up and down. Then put a tourniquet on the arm about 2 to 6 inches above the insertion site. Then I will look for a pulse distal to the tourniquet. Don sterile gloves. And using the alcohol swab, we must clean the surface area or the site in a circular outward motion. And let it dry on its own. Now we are going to open the catheter for cannula insertion. Now make sure that the needle is on bevel side up. Now what we are going to do is to pierce the skin of the patient and enter the vein directly above or from the side in one quick motion. Once you see a flash of blood or backflow, that means that you are in the right spot. Then what you are going to do is advance your index finger to advance the catheter, and the needle is going to be retracted once you hear a click. Flatten the cannula, stabilize the device, and advance the cannula at skin level. Now, slip a sterile gauze under the hub and apply pressure just beyond the catheter tip. Release the tourniquet and hold the pressure because we will flush it later and we don't want to make a bloody mess. Then, attach the extension line. This part is going to screw to this part of the cannula, and we are going to unscrew it, for example, and do it as quickly as possible. There we go. We might spill a little bit of blood and that's okay. We can clean it up later. By the dressing, make sure that the site is clean of blood and moisture. With 5 to 10 ml of sodium chloride to secure patency. Finally, for the IV fluid administration, I will connect the infusion tubing of the prepared IV fluid to the IV catheter. Open the roller clamp and regulate the fluid. Explain the procedure and reassure the patient. Sir, we are almost done with the IV therapy. Are you okay?
Yes.
Okay. Now secure the IV tubing with a tape. Calibrate the IV fluid bottle and regulate the flow according to the order of the physician. Then, we must label on IV tape near the IV site the date of insertion, type and gauge of IV catheter, and countersign. Label the IV tubing to indicate the date when to change the tubing. Observe the patient and report any untoward effects such as swelling, pain, redness, or leakage of fluid. Then, dispose sharps and wastes according to healthcare waste management. Finally, the following must be documented in the patient's notes after the procedure: date and time the therapy was initiated and type of vascular access device, type and gauge of cannula, date and time of insertion, type and amount of IV solution, reasons for IV therapy, patient response to procedure, and name and title of healthcare provider who inserted the catheter. The following are the needed equipments for the procedure: IV fluid, Blood administration set. Blood product. Set of sterile gloves and pre-transfusion medication. Now I will open the blood administration set. And I will label the IV tubing with the date and time. Prior performing the procedure, we must verify that informed consent has been secured. Sir, I'm going to perform a blood transfusion. Do I have your permission to proceed?
Okay.
Okay. Now we're going to verify the physician's order. And then, noting the indication, as well as the rate of transfusion, and administer pre-transfusion medication as prescribed. Two nurses must verify the patient and blood product identification. Sir, can you please tell me your name and date of birth, please?
My name is John Paul Denao, November 17, 1999.
Compare the patient name and hospital identification number on the patient's identification bracelet with the patient name and hospital identification number on the blood bank form attached to the blood product. Both qualified nurses must sign the blood bank form attached to the blood product container. Compare the unit identification number and the patient's blood type listed on the blood bank form with what is listed on the blood product container. Document on the blood bank form the date and time that the transfusion has begun. Assure patency of IV line. Place the spike into the ort of the solution container. Hang normal saline flush bag. Spike normal saline bag and prime tubing, filling blood tubing filter completely. Inspect the tubing for air and flick the tubing with a fingernail to mobilize the bubbles. Invert the blood product container. Spike the blood product container through the port and slowly open the roller clamp closest to the blood product. Obtain and record the patient's vital signs, including the temperature, before beginning the transfusion. Attach the distal end of the administration set to the IV catheter. Stay with the patient during the first 5 minutes and then obtain the vital signs. Take note of transfusion reactions. Monitor vital signs in 15 minutes, then again in 30 minutes, and then hourly while the transfusion infuses. Obtain vital signs and auscultate heart and breath sounds. Close the roller clamp closest to the blood product container. Disconnect the blood administration set from the IV catheter. Flush the administration set. Discard the empty blood container and administration set in the proper receptacle. Perform hand hygiene and infection control protocols. Document necessary data after the procedure.